So now we've talked about strategies to assess ankle dorsiflexion functionally and on the table, and we've even shown how you treat it. We now need to give our patients exercises that they can use at home to stretch out the myofascia and also mobilize that ankle joint. So Patrick here is going to do just a quick and easy downward dog. A downward dog really is such a good exercise as far as working on the ankle mobility if you do it right. And so he's just going to drive his hips backwards. So Pat, just go ahead and drive bilaterally. You can see he's pretty tight in his calves there. And just go back and forth, Pat, kind of go into a push-up, and then you can drive it back. And you can also, in this case, use a band as well to help that posterior glide at home and just kind of stay in that end range position. From here, he can also go into I guess it would be a one-legged stance there in this position, and he can just drive his foot back in these different vectors. And so Pat, try to maybe move your foot back there a little bit further so you're compensating. And so you see he's pretty limited, so we moved him back because there's not as much dorsiflexion. And then he can even change the vector, so he can even reach across over there to get a little more eversion at the subtalar joint with the ankle dorsiflexion, or he can even reach over here and hit my hand and get a little bit more inversion. You can see he's struggling a little bit with that there. So that's just a key pointer, FYI, that usually the ankle joint is lacking dorsiflexion with that subtalar joint's going through inversion. From here we can also do some different balance excursions. You can have Patrick go ahead and just stand on that X for us. And let's just have you reach out for everyone out there in video land. And so we're really working that stance leg dorsiflexion. Similarly, we can also bias the different planes. We can have him reach across, getting that subtalar joint inverted, or we can even have him reach across that 45 and really get that ankle dorsiflexion. From here, another really good exercise strategy might be just to have him do some squatting in different planes. So Pat, would you mind just doing an anterior lunge or anterior squat for me? Just kind of squat, yep. And so you want to typically cue your patients to just really drive their knee forward on these when you do this. So that's really going to help kind of mobilize the ankle joint. And so this could be, corrective in nature and functional specific to the ankle joint. From here, you can also do is add the hands in different ways to kind of bias that subtalar joint. So Pat, when you do that anterior lunge or squat, would you just swing your hands to the right for me? And here you can see we're getting a little bit more eversion. And if I wanted to take that out, I can also swing his hands back the other way. So go ahead and swing your hands the other way. Perfect. And so obviously you can do, any sort of calf stretch, which is going to put the ankle in dorsiflexion and also work on some myofascial lengthening in those different positions. But these are just some different ideas and strategies. Obviously you can make up 1,000 different ways that you want to mobilize that ankle, but these are just a few that I just thought of off my head. So give these exercises a try and use these different strategies to help your patients improve their ankle dorsiflexion.